Hi, my name is Prabh Sandhu, and today I'll be doing a presentation about ischemic stroke pathogenesis and clinical manifestation. Sorry, my throat's a bit dry today. Today's presentation is about Mr. Marks, who is a 68-year-old male who has a history of hypertension, which was diagnosed 2 years ago, and is currently experiencing severe right-sided weakness, right-sided facial droop, incomprehensible words, and right hemiopnea. Let's begin by establishing what a stroke is. An ischemic stroke occurs when there is a reduction of oxygen and glucose supply to the brain cells due to a blockage from a thrombus or an emboli in the blood vessels that supply oxygen and glucose to the brain. Most ischemic strokes are due to large vessel disease. It's caused by factors such as narrowing of blood vessels due to hypertension, which leads to a higher blood pressure, and raised blood cholesterol, which also leads to a higher blood pressure. Since the amount of room the artery has for the blood to pass through becomes smaller, it leads to more pressure on the artery, which leads to higher chances of stroke occurring. The brain requires an active supply of glucose and oxygen as it doesn't have the ability to store it. When the supply is cut off due to obstructions, it can lead to cerebral infarction. Cerebral infarction is essentially brain tissue death due to lack of oxygen and glucose available to the brain tissue. The most common cause of a blockage in artery are emboli and thrombus. They're essentially blood clots which cause obstruction within an artery and affect the blood supply being able to pass through. They can originate from the left atrium or the left ventricle walls of the heart, where they break off and travel to the brain, where they begin blocking the arteries that supply to the brain. Mr. Mark has been diagnosed with left MCA stroke, which pretty much means left middle cerebral artery stroke. Due to this, the right side of his brain has been affected by a condition known as hemiparesis and unilateral paresis, which causes weakness in one side of the body. In Mr. Mark's case, it's the right side of his body. Usually, if the left side of the body is being affected, it has something to do with the right side of the brain. And if the right side is being affected, it has something to do with the left side of the brain not getting enough oxygen or glucose. Due to the left MCA stroke, the supply of blood to the brain has been reduced in regions of the left parietal lobe. It has affected Mr. Mark's right side of the body, which has led to his right side face drooping, right side body weakness, as this is a result of motor deficit, which leads to delayed and interruption to the CNS, central nervous system, in terms of movement, which leads to weakness and limitation in terms of motor movements. The middle cerebral artery also supplies blood to the Wernicke and Broca's region of the brain. These regions are responsible for intelligible speech production and interpretation. Since they have been affected by poor blood supply due to clotting, it has led to deterioration, which has led to Mr. Marks not being able to produce comprehensible words. The Glasgow Coma Scale is quite normal, which means the damage isn't severe, as still in the normal ranges. But it could be an indication or a warning for a TIA. A TIA is a transient ischemic attack, which is essentially a warning for a progressing cerebral disease, as all the symptoms match those of a TIA, such as one-sided weakness, vision and speech problems. The factor that Mr. Mark has had hypertension for the last 2 years also plays a factor, as it could lead to the contribution of the stroke, as hypertension is known to cause thickness of arteries when blood pressure increases. The arteries also push back harder, which leads to the walls of the arteries lumen narrowing and the artery walls thickening. Right hemianopia is when vision loss occurs due to the left side of the brain being affected, which is due to the fact that blood supply to the occipital lobe has been affected, which has led to a deficit in the right eye in terms of vision for Mr. Marks. And that's it for today. I hope you enjoyed my presentation. Thank you.